Hi, and welcome to an in-service on our PCA and CLAI infusion pumps. On 5B North, we will soon start taking PCA pumps, meaning patient-controlled analgesia, and we will also start taking something called CLAI, continuous local anesthetic infusions. So patient-controlled analgesia is pretty simple. Either morphine or hydromorphone will be provided through this pump, and the patient delivers the desired amount or the timing of that amount. With CLAI, you will have a continuous infusion either through a catheter that sits beside the incision or a catheter that is placed by the anesthetist sitting in the paravertebral spot. So when you look at the spinal cord, there is a paravertebral space and then there is an epidural space. The paravertebral is where our patients will have their catheter placed, and there should be no motor impingement, so they shouldn't have any loss of muscle use. It should just be a local freezing or a sensation loss. So the pump that we will use is the same. Functionality is the same. But the PCA pump you'll see is green around the screen and says PCA on it. The CLAI pump will have a yellow area here and it will say epidural. Please remember that we do not take epidurals on 5B North, only paravertebral or continuous infusion through a subcutaneous catheter. So to look at the pump and to prime the tubing is unique to the pump. No other tubing can be used. And there's two sets of tubing, one for the PCA and one for the CLAI. So the CLAI, I don't know how well it transmits here, but you can see that it has a yellow line on it. The yellow will correlate with the screen. The nice thing about this CLAI tubing is when you look at it, there are 0 injection ports on it, meaning we should never be injecting into that. The PCA tubing is also unique in that it has a Y already connected to it. So you are going to connect your safety line to here, which is the opposite of what we do now. Normally this would be the safety line and the drug would piggyback. The opposite is true. You're going to prime the tubing with narcotic all the way down to the end, and this will attach to the patient. So just attach that to your saline lock. And this will have your continuous infusion. And there has to have an infusion because a PCA in our facility will never be or never have a continuous infusion component to it. So you will need an IV line to drive that drug forward. The important part about that IV line is it should be running at a consistent rate so that the saline or the D5 is always running at 20 or 40 or 50, whatever you feel you need the pump to go at, so that the drug is consistently delivered to the patient. So when we look at the pump, you'll see at the top it says lift to open. So to put the tubing in here, you have to lift this to open and then pull it up like that. There's already tubing in here. I'm going to take it out and we're going to look. Here is a blue cassette and here is a yellow cassette. And when you look at the pump, you can see that there is a blue arrow on this side and a yellow arrow on this side. So pretty easy. It friction fits or just slides in So just slides in. I've got the blue in, I've got the yellow in, and now I'm going to fold the door back. Oops, my blue has come out. The door flips down, and you'll snap it to lock it. So now it's locked in place. In order to prime this tubing, you have to turn the pump on. So go ahead, turn it on, and you're going to get a self-test. You'll see the run button light up. You'll see the standby button and the alarm button. And now it's also going to tell you about the external power. And so the first screen that you will see here, it says select, enter to select library. So the enter button is the yes button. So it comes up, new program. I'm going to hit yes. Now I have to enter a code, and the code is the same for all. 94629, and hit yes. So now I have the option, and you can't see it, it doesn't project well here. You're going to see morphine as your top one. Your next one is going to be hydromorphone. So use your arrow to move down to morphine PCA. This is not a registered nurse's scope of practice. This needs to be either done by the nurse associate, the surgeon, or the anesthetist. So he or she will hit yes. And then, although you can't see it, there is a lot of writing here, and it's going to go through all of the prescriptions that are available. There is morphine 1 milligram with a lockout of every 6 minutes, so the patient can receive it 10 times per hour. Then there is morphine 1 milligram with a lockout of 5 minutes, where they can get it 12 times per hour. And then there is a little higher dose of morphine, 1.5 milligrams, where they can receive 6 and 1 dose every 6 minutes or 10 per hour. So I'm going to use my arrow, and I'm going to scroll down, and I'm going to highlight the prescription that the physician has requested. So as a nurse associate, I would do this and hit yes. And then it's going to say confirm. I'm going to hit yes again. And now I have to scroll through all of these requests. This is just a review of what the patient is going to receive. And I keep hitting yes, 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 done, yes. And then I'm going to hit, this screen comes up and it says press run. And now my pump is infusing. It's always going to be scrolling, and I'm sorry that you can't see the screen very well, but it's always going to be scrolling through what the prescription is and what the patient is doing. So let's go through the pump and look at some of the numbers. So number 1 will give you the date and time. If you push it while the pump is running, it gives you the date and the time. Number 2 is to do a power check to see how much life is left in the batteries that are at the back. It takes C batteries, and we will go through how to change those when we have some hands-on with the pump. Number 3 is options info. This isn't a button that you will likely have to go to. It's how many pounds per second it pushes in, how loud the alarm is. These are all preset and defaults in the machine, so I would just leave them. The next one you might want to use is number 4 is screen hold. The annoying part of this pump is it keeps scrolling and you're trying to get the info and it's scrolled to the next screen. It's really quite annoying. Number 5 is the hourly total that your patient has received. So 5, you might want to look at that. 6 is the therapy info. So this will be your prescription. You should go to this whenever you come on shift, and it should be checked every hour. Number 7 is the treatment info. So when I push this, and I'm so sorry, let me see if I can turn the light off. Well, it's not much better. But it comes up and it will tell you what has been happening with the patient. I am going to take the PCA, and this is the button that is attached to the PCA. And it is just like the patient's call bell. So we will be trading out the regular call bell for one that is provided with the pump. So you'll take the call bell out of the wall and put the new one in. And it's a nice big, it's quite a large one. And there's either a red cross on it or an icon of a nurse. And that's how the patient pushes to put the pump in, or the bell into action. So right now you can see, not well, but you can see it scrolling through, and it's saying right now 0 milligrams. I am going to give myself some hydromorphone, and you can see that it has gone through the tubing. And so it says it goes all the way up to when the 1 milligram is infused, and then it tells me what's left in the bag, remaining 99.5 mils. Let's say I want more. Hey, I'm really hurting here. I want more. It comes up and says alert, patient requested, but you're going to see down below, I wish you could see it. I'm going to request it again. I'm requesting again. So there's the alert. It's only going to let me have it. And then it says down here, 1 of 4 boluses. So at any time you can go into the number 6, the therapy info, and it will tell you how many. So if it said 1 of 4 boluses, that means the patient has received 1 but requested it 4 times. So you can tell every hour or at the end of a shift how many times the patient has requested to receive narcotic. And maybe it's not enough for him, or maybe he needs some education and doesn't understand how the pump works, or better yet, he may think it's a call bell. So some patients may get confused. So it's important that the nurse remember to remind him how to use the pump. So number 7 is the treatment info. Number 8 is percentage of bolus. And I'll be honest, I don't truly understand that button. Number 9 is how to clear your volume at the end of a shift. So you hit number 9 and it tells you what's your code, 94629. And then I don't want to exit right now, so I hit no. I want to clear. So then it comes up and it says clear at the bottom. You're going to hit yes or enter. I don't know how well, you can't see it well at all. I'm so sorry. There's too much of a glare on the screen. Anyway, number 9 is how you clear the volume. And if you've cleared it and you think, well, I wonder if that's worked or not, just push it again and it will say 0 mils. So it's an additional confirmation. Anytime you want to stop the pump, you're going to hit pause. And then you can see up on the screen, it says resume. you can hit yes. Then it will say push run to start. So run. And now this light will show up and it is running. Most important button ever, silence button. And this is the button that you would prime the tubing with. So prior to hooking it up to the patient, you're going to push and hold this button, and up in the screen it's going to say continue to push prime or run to start. So as soon as you have primed the tubing, the fluid to the end of the tubing, then you will stop hitting that prime button and go back up here to run, connect it to the patient, and the patient would be ready to go. So I think that's most of what I wanted to show you about this pump. If you have any questions, you each have my cell phone, 506-721-7911. Don't be afraid to give me a call, send me a text. And the staff on 3C North are really the in-house experts on these pumps, so they will certainly come up and help you. Anytime you need to access it, remember there is a key. 94629 is the pump code. It's the same code for all pumps. So thank you for your attention and good luck with this initiative.